Hey there everyone, welcome back to my channel. This is Tricia here from Devoted Healthcare Consultants. I am here visiting with you guys again as promised. I have come back. I'm so glad to be back, and I'm so grateful for all of my followers. I thank you for subscribing to my channel, and if you haven't so far, please hit the button down below and subscribe. So here I am talking about on my channel about people that want to start home care agencies or already have home care agencies, and some of the things that you should do, some of the things that you should not do when having a home care agency. So one of the things that when running a home care agency, you need to do annual training. I did speak about a little bit on the previous video, but I'm going to go in a little bit more in depth to what you should do when you have annual training with your staff. So your staff will contain mostly CNAs or people that you're training to take care of your clients when they do come onto your service. So annually, you need to go over certain things with them just to make sure that they are doing the things that you have put on their job description, and they understand some of the policies, if you do have policies for your agency, some of those things that you should be doing. So I'm just going to list a couple of them, okay, for you so you'll know. But if you are in a regulated state, they pretty much give you an idea of what needs to be on your annual training with your employees every year, okay? So I'm just looking at my list here. One of them is ensuring that you have they have first aid and safety and CPR training, okay? So they should be make sure, usually the CPR training is good for about 2 years, but you want to make sure that you're checking to make sure that their CPR training has not expired, okay? And you want to make sure they sign off on that every year. You sign off on it as well, making sure that your staff knows how to do CPR. If someone is a full code, meaning that they're supposed to have CPR, if their heart were to stop, if they stop breathing, they know what to do if they're with this client, because you're not going to be with them. You're trusting your staff knows what to do in case of an emergency with one of your clients, and the family members also, and that client is banking on the fact that you have hired qualified staff that knows what they're doing, okay, when they're with the client or with the client's the POA's loved one, okay? They want to make sure that if they're off doing what they have to do, whether it be at work or however, that when that caregiver is there, that if something were to happen, that they know how to handle the situation. And CPR is one of those things. First aid and CPR. If they got a cut, do they know what to do? Right? So you have to ensure annually, make sure you cover yourself, okay, that your staff knows what to do in case of an emergency. So that is one of the things, is first aid and CPR, okay? Another one is how they handle emergencies. Do they need to call you? Or do you have a nurse on staff that they're supposed to call? Do they know what numbers to call? Do they need to call 911? In what order do they notify the family? You have to break down in what order they're supposed to contact whomever, okay? Those people that I just listed, okay? So they have to be trained. Some people forget. A whole year could go by and nothing could have happened, right? So they have to be reminded of those things annually. And once they sign off, they're stating that they understand what your policies and what your steps are, okay? All right, so another one is about confidentiality and HIPAA, okay? So, when you go to the doctor, they come up with this form. When you first start with a doctor's office, they give you a form. Most people don't read it, but because it's very lengthy, but in other words, it's saying that as an employee working for a company, I'm supposed to keep a client or a patient's information to myself if I have to review it or look at it for some reason. We're not supposed to go off now and go tell cousin Sharon and be like, oh yeah, hey Tito, come on over here, I want to show you something. Or get in the elevator and be discussing, Mr. Paul's just had some kind of a medication added to his list, or you're not supposed to do that. So that is what confidentiality is about, okay, and HIPAA. So if a company is, an employee does not follow those guidelines, and when you're working for a healthcare company and providing care for someone, if it's breached, your company can be in trouble, okay? Because it is a law that you're supposed to keep patients and clients' information confidential, not giving out any phone numbers, banking information, anything like that, because your caregivers are very close knit with the client, and they may be hearing things or seeing things because they're in the person's personal space, and they may hear or see something that that's confidential. And think about yourself. You don't want anyone discussing your personal information with anyone or showing it to someone. So in that way, you are showing them and teaching them. Annually, they have to sign off that they understand that is part of their role as an employee at your company. So that is something that you will also have on your annual training, okay? Another one could be, and this is the last one that I'm giving, but there are several other things that may be listed for that particular state that you're in, okay? Dress code. So you may have a dress code for your company. It may be a particular color. Maybe like some people wear dark blue. It's very common for this kind of a service. Dark blue, maybe white. There are very nice colors out now, but you may have a dress code that you may want. You may say, I don't want to see tattoos. It's very common now that people have tattoos, and it's wonderful. It's beautiful art. But when you're in the workplace, some companies may say they don't want to have that shown. So they want it covered. They may say you can only wear one pair of earrings. Well, I'm wearing loop earrings because I'm not at work today, but going to work, I won't wear certain kind of earrings because in my policies for my job, they will say, that they want you to wear maybe a small, neat earring, to work. That may be part of your policy. So you will review that with your staff every year, and they will sign off that this is the particular dress code. No open toe shoes, because you can get an injury and then the company can be liable. So you want to make sure that you wear proper shoes. So just saying, these are some things that may be on the list. It doesn't have to be, but it may be for your state. That certain dress code may be important, or just for your company. You may decide to make those particular suggestions or requirements, not suggestions, requirements for employees that work for your company. So they need to be reminded of that annually. And if a survey were to come out, they would look at your policies. If you have policies for your company, if you're regulated, if they come out, they may look at that and say, well, did this person sign off on this, so on, so on, So just wanted to give you a few tips. Again, if you have a home care agency or deciding to have a home care agency, these are some things that may be required. And I really truly hope that these tips have helped you or are going to help you. Again, I am Tricia Thomas, RN, from Devoted Healthcare Consultants. I do help people start home care agencies. If you are interested, you can send me an email at info@devotedhealthcareconsultants.com. Information is below if you're interested in purchasing my ebook. It is also available for you if you would like. Information is also below. Again, if you liked my video, please give me a thumbs up. I would truly appreciate it. And also, if you like my content, please subscribe to my channel. I would love to have you. Thank you so much for taking time to listen to my video. I hope it has enriched you and added value to your life. Take care. Bye-bye.